I'm Dr Tom Malins, and I'm a clinical director of the Severn Health PCN, along with Dr Anne Hampton. With Price's Mill Surgery, we've got 9,000 patients, and with the PCN, we have around 40,000 patients in total. And as of this morning, we have given first dose to around 20,000 people. We've given 2 doses to around 5,500 people. So, that's going to be fairly uniform through the practices, because it's a central booking hub that we are using to achieve that. So, that's massive and really quite humbling in terms of that's been achieved over 3 months, and it's been a huge amount of work and commitment from a lot of staff and volunteers to get that going. And every Monday when we have the sort of debrief and planning meeting, that number ticks up, or those numbers tick up, and you can feel that even though there are massive challenges with putting this together, you feel that that's so worthwhile, and that we are actually getting through it quite rapidly, really. I think we're probably at around the 75-year-old, that sort of mark at the moment, in terms of beginning to invite these for completing their second dose. So we are giving doses at the 11th week. That's a sort of our default, that if you've had a dose on such and such a day, if you look 11 weeks into the future, your dose will be on that day. There has been some opportunity to bring second doses forward, and so as long as the second dose is given after 8 weeks, that's reasonable. But anything between 8 and 12 weeks is fine. I think there's not a wealth of information on what the difference between 8 weeks and 12 weeks would make to your overall length of immunity or immune reaction or anything like that. So I've not seen anything to say 8 weeks is better than 12 weeks, for example, or 12 weeks is better than 3 weeks. I think it certainly made sense to get the coverage. That was key, and I would say most patients are having it at about 11 weeks, and some are having it earlier, but none earlier than 8 weeks. At the end of March, we had the news that that there was going to be a supply issue with the AstraZeneca vaccine, and this was a national problem, and our immediate concern really is we've got two issues. We need to vaccinate the population and get first doses done, but we also have the time sensitive issue of giving second doses. So the first query was, are second doses guaranteed? And yes, they are, and I can't see any reason why that would change over the course of this month. That anyone who is due, usually we're giving the vaccine sort of on or at the 11-week mark. So anyone who is due, that's guaranteed, and the supply has been sort of ring fenced. So I would want people not to worry about supply issues regarding their second dose. Regarding the first dose, because of the supply issues, the instruction is actually pause first doses at the moment, unless there is a desperate clinical need, and that's pretty rare. That's things like chemotherapy or immunotherapy that need to start out of clinical urgency. So the fact that we can proceed along the second doses, actually in April, is quite good, because in the corresponding 11 weeks ago, we actually had a reasonable amount of vaccinations going on. So April's not entirely quiet. It's actually going to be quite busy, and quite busy towards the end of the month in Severn Health. When it changed from 3 weeks to 12 weeks, there was a huge amount of work to cancel booked appointments, and that's a massive drain on GP services. And now, at a time where we are actually wanting and hoping to be very busy with normal GP work is not something that we can afford. So booking in second doses, for example, we do need to know that we have assurance of we will have enough vaccine to give that clinic. And so there's that side of things. There's the staffing the clinic side of things, and I think I would like to give assurance to patients that as they approach the 11-week mark, they're likely to be contacted within the 1 to 2 weeks prior to that. In some circumstances, say, you know, it's been more difficult to contact. For example, patient hasn't got a mobile phone, they don't have an answer phone service. You know, actually that notice could be shortened because it's been difficult to contact them. And I think if patients are, you know, really, you know, it's nearly 11 weeks and they are concerned, then the only thing that would be reasonable to do is, you know, call the GP surgery and say, you know, do I need to be concerned? Because the GP surgeries will have sort of an oversight as to where the bookings are at. But again, I would say, you know, I would mostly rest assured that this is a process with lots of checks and balances, to mean that people who are due to be vaccinated will be contacted, and there's a massive effort to make that happen. So patients contacting the surgeries to ask, I've not been contacted yet, you know, can you give me any news, can be a big drain on the GP surgeries. So there is a balance to strike, but I think if you're nearly at 11 weeks and you've not heard anything, you know, within a few days, that would probably be unusual. And I would say, you know, is there a problem with my contact details or something like that you need to update with your surgery? It should be the normal that if you have a first dose somewhere, you have a second dose in the same place, because we are expecting that second dose to come to the same place. That is not always possible because people move and people end up in hospital and discharge other places. So there are exceptions. There's always going to be exceptions, and there's sort of, we try and work in some capacity to accommodate that. Yeah, ideally it's in the same centre. Nationally, when you have a dose, it gets logged in there, and that gets pulled into your GP record. And so from usually a day after, sometimes takes a little bit to just to update the GP record, then we know this person has had their first dose, for example, and it tells them who's done it and where it was and what type of vaccine it was. And so we can extract that information back from their record to inform our systems of invites for second doses. So, for example, people that have you know, moved to the area and they're worried that, you know, how am my GP going to know that I've had it? It will be within your record and it will be searchable to us, and we run these searches all the time to try and pick up people who are coming due for their second dose, for example. So, you know, it's a matter of course that we're constantly sort of checking that out. People can have a lot of confidence after the first dose, but after the second dose, they're really sort of walking away, and sometimes completely, it's almost transformative, because they've been incredibly fearful, understandably fearful, for the last year, you know, haven't been out, and actually now they can begin to get back to some sort of normal life, which is the whole point. You know, this is a really wonderful thing to be a part of in that sense, and I hope that people lose that sense of fearfulness, and that just continues to build, and that's my main hope for everyone.